This week on the BackTable podcast.
I think the biggest thing for me is if you do seek out a position of leadership, you need to care about this as a number one priority of don't just think about the prestige of getting a leadership position. Think about how you can change someone's life for the better if they are struggling, because if those people are working hard and putting up with whatever BS comes their way and are doing the lines within the same day they're consulted, you may look good as a leader to the hospital, but are you doing what's right to your colleagues? And I think if you do seek these positions out, you should care and have a plan for what you're going to do to support somebody through a tough time.
Hello, everyone, and welcome to BackTable, your source for all things endovascular and more. You can find all of our episodes online on any platform you prefer, like Spotify, Apple Podcasts, or directly through our website, backtable.com. I'm Sabine as your host today, and I'm here with the real Dr. J, Dr. Jenanan Vairavamurthy, and I are from Mount Sinai, New York. Welcome, Jay.
Thanks for having me, Sabine, and congrats on getting my name right.
Good. It was pretty, we had to practice it before this session right now, so... Today, we're going to be switching gears. Instead of putting my, peripheral vascular stroke hat on, we're going to be talking about mental health and something that's usually brushed under the rug, not really talked about enough, even on our platform. So it's near and dear, both of us. And just a warning to everyone out there that this episode might get a little heavy. But if there's any questions, concerns, please reach out to us. We're happy to answer them and help in any way. So Jay, before we get into the nitty gritty and the deepness of this podcast, tell our listeners a little bit more about yourself and really how to pronounce your last name too.
Oh, so yeah, Jay Vairavamurthy. My first name is Jenanan, but everybody calls me Jay. I live in New York now. I did residency in New York City as well and grew up here, but was in LA for a long time, working at USC where I got to know you a lot better and hang out. And just moved back recently, and part of that was, driven by some family stuff, which I think we'll kind of talk about today. But nothing, it's been great to be back in New York, be with friends and family, and we welcomed a baby about 9 months ago. So that's a big aspect of my life now.
Congratulations.
Yeah. So things have changed a lot over the past few years, and some for the good and some for the bad. Part of I think anyone's journey is reflecting on big changes. A lot of that comes with assessing your mental health and being in the right mind space and kind of the things that we all go through, I think, can really affect us in ways that build over time. And if we don't reflect on them and think about it, then it's can be overwhelming. So I think this is a good time in my life for us to kind of be chatting about this stuff.
Totally. I mean, I appreciate you coming onto the show, talking about really vulnerable topics. I mean, I would say probably for a lot of listeners, if not all, everyone's experienced some sort of mental health issue, whether big or small, and we just don't talk about it. We don't, address it, and it's probably your own ego and pride for a lot of people to just keep it internalized. So
I would also add it's ego and pride, but it's also a cultural thing. And I guess the number one thing for me now is addressing, I'm not trying to be a crusader or anything like that, but just in my interactions with trainees, colleagues, friends, it's just saying it's okay to talk about this and let me help you figure something out if I can, or let's point you in the right direction. Especially we're in the backdrop right now of Mental Health Awareness Month, and I question whether us as a field have really capitalized on what that means and talk about it the way we may talk about other months or weeks or whatever like that are celebrated throughout the year.
Absolutely. I mean, even a place like California where wellness is a big thing, I haven't seen much talked about Mental Health Awareness Month, and especially specific to IR. When someone says mental health awareness to you, Jay, what do you think about?
I think about acknowledging what you're feeling and having an opportunity to really sit in those feelings and not always try to push them away or disregard them. Coming from a place where we're taught resilience is just pushing forward, I've come to learn that mental health is not just pushing forward. It's acknowledging why you might feel a certain way and kind of question what is making you feel that way. And I think a positive way of being aware of your mental health is knowing that there are instruments and tools out there to work on improving your mental health. But the most important thing is first recognizing if there's a problem and acknowledging that a problem is not necessarily a problem in the way we talk about things. It's not like, oh, I feel off, or things, I feel anxious, I feel depressed. I hesitate on constantly saying that's bad. That could be good. That could be telling you that something's not right. You're doing something that's not natural. You're doing something that in your body is saying, hey, this isn't for you. And that could be a small thing. It could be a big thing. And I think the biggest struggle in medicine and mental health is you're on a track. Once you say you're pre-med or once you take the MCAT, you're on a track. And the guardrails of the track are other people that are judging you, pushing you, telling you what to do. And that track just seems off now. The track does not really seem to allow people to express what they're feeling, if it's good or bad. And then at the end of that road, if you don't like it, how are we going to address that? And I think for me, mental health is a comprehensive thing. It's how you feel and all that stuff too, mentally, but it's also what can you do to kind of address mental health in a productive, positive way. And that's where I feel that there's a lot of trouble in medicine.
I mean, so tell us, how did mental health and this whole topic, why is it so near and dear to you? And then we can kind of go into specific tools that, both you used and your family used during the process.
Yeah, I think, this time 2 years ago, I was completely a different person. What you see now and what you hear now is probably the opposite of how I behaved before. I was that apologist for the system of being like, yes, move forward, do well on tests, do your 24-hour shift, don't complain, as long as it's an ACGME, all that type of stuff. I was like the number one spokesman of being like, oh, we have such a gifted life being in medicine. We get to take care of people. We have some societal respect. We have some societal income that's pretty good and everything, don't complain, right? Take what you're given and kind of be happy. Appreciate the good. Don't worry about the bad. And my brother was a physician as well. He was the opposite. He loved the idea of taking care of people and using his intelligence to be able to navigate challenging problems for people. The problems in the healthcare training pathway and the system and his day-to-day job were gnawing at him in perpetuity, in ways that he was open about. And I was the devil's advocate telling him, no, like, you're wrong. Like, you got to change your mind. Like, this is a you problem and your complaints are completely invalid. And, this is my brother that I'm telling this to because we were close and I felt comfortable talking like that. There's not a day that goes by that I don't regret those conversations, not a day that goes by that I don't regret those conversations of just being this apologist. And he struggled for a long time. And I knew he had, he always had a backdrop of depression. His diagnosis was really challenging, actually. There was depression, there was some anxiety, going through the history of what he struggled with is a little bit complicated. But I think that's the thing for all people struggling with mental health. It is hard to diagnose at times. And he ultimately succumbed to that 2 years ago. May 21st of 2022, he committed suicide. And I have been reeling from that since. And he did it, while he was on a locums assignment. And so there's just a lot of, I'm not here to say that medicine drives people to do these types of things. I think the biggest message is there are people that are struggling. Our colleagues, our friends, family, they are struggling. They are doctors. Those two things can be true. You can be a doctor and you could be struggling. And the question is, what do we do? Because this is getting worse and worse. This is not a single thing. Like, I've become probably more vocal about it than I had been in the past. And so I've connected with people on social media that can just kind of feel comfortable telling me their story. And then, every now and then I'll see a Twitter post, resident here, so-and-so, resident here, so-and-so. And it's only increasing in numbers. And it's not because their mental health is only driving this. The last thing people feel before they do an act like that is complete disconnection, isolation. And so if we're part of a medical community, how could we let people feel that disconnected? It just seems like we care about everybody else, and we overextend ourselves to take care of people or to please, an administrator somewhere, whatever the case may be. But what are we doing for each other? What environment are we creating? And, he was my own brother. And I, as a physician, I was like, you're wrong. As a brother, I had a lot of empathy for him, like I really extended myself to try to be as supportive as possible, as a family member. But as a physician, when he would complain, I did not see eye to eye. And it took his passing for me to really be like, what is going on? What is happening here? I think it's important to kind of, I could share his story, just,
Yeah.
and I think people.
First of all, I just want to say, like, I'm sorry for what he went through, what you've gone through, your family. I mean, it's something that's you never want to hear that. So I'm sorry. And I know I'm speaking from the audience too. You said, I mean, what do we do? I mean, I agree. This pandemic of feeling like crap in medicine, it's only good. I mean, you just can hear people with their disinterest and not being happy. I mean, just look at things online specific in IR. I mean, you have, line monkeys saying stuff and this and that, and people are just not happy, and that can instigate a lot of things. So what do we do?
Well, I think it takes a acknowledgement of, what wellness really is first. I'm going to be a little bit on a soapbox here because I do struggle with what wellness means in medicine nowadays. I think there has been this mental health awareness across the country in any shape or form, society-wise. I think people are more in tune with at least acknowledging mental health issues. And I think in medicine, we've taken wellness, and at first it started with happy hours, right? Wellness happy hour. It's just drink away how you feel, And then it became, wellness, yoga, encourage that type of stuff. And wellness to me is so simple. It's how do we allow somebody to do what they want to do? It's not a 5-minute break. It's not an ice cream social. Like, that's not wellness, A wellness is, we are talented people who are extremely well trained, who sacrifice so much. What do we want to do? We want to take care of people. We want to take care of people the way we were trained to take care of people. And the way medicine is now is you're not taking care of a patient. The autonomy that you have to decide how to take care of a patient is very constricted. And so a lot of the things that we do are forced to play a game when it comes to billing or, administrative rules, and the flexibility you have to connect with patients is sacrificed. Just anecdotally, my brother, he was the biggest empath, right? You could talk to him for hours, just hours. And I think a lot of people that suffer with really bad mental health issues are some of the most empathetic, kind people you'll meet. And you may not know that they're suffering because they will always put on a different front. But I knew he was suffering, but he would still connect. He would meet my friends or whatever. He would just talk to them for hours. And I think that was reflective in his friend group being so vast and wide. Of even my closest friends in life they would call him to talk to him because he was just so good at connecting with people and listening. But he would take that on. And so when he would talk to patients, he would spend hours, an hour or 2 hours in their rooms, just sitting, chatting, finding about families. The cards he would get from patients were you asked about this thing, it brought this memory back. I was like, what are you doing in these rooms, dude? You're really finding out about these people. But so he got an email from an employer that was basically you spend too much time with your patients and not enough time, focusing on charting and billing and all that. And those types of things, I think, not wellness, right? It's just an obstruction for him to actually connect and take care of his patients. That type of rigidity in a system makes it hard. You're only going to be able to, the people that will be content in medicine eventually on this trajectory, I feel, and this is just my opinion, are people that are particularly good at, seeing it as like a productivity-based thing. like your job is just about points on an RVU dashboard, or they're, and people that get the thrill out of that, or whatever financial reward they get, I think those people will rise to the top. And the people that, are really trying to, connect with people and understand their problems and be very intentional with how they interact with patients, I don't think the system is designed for them to find a lot of professional satisfaction. They have to really fight for it in their day-to-day moments. But in the grand scheme, they're suffering because, if you spend time talking to someone and they're, connecting with you, telling them their hopes and fears, and then you're able to take that information, calm some of their fears, and get them on a treatment plan, that should be the goal. But what the real goal is how many patients did you see this hour? Did your notes get done? And the billing company knows.
Totally.
And right. And if you want to do that part where you're talking to a patient, well, you're going to stay until 8 p.m. because you need to do the other stuff. But don't worry, like that's on you. And again, that does work for some people. I'm not sure, like the idealistic med student or college student really understands that. I think they see medicine as like, I can make a difference in someone's life. And at some point that changes where you see patients, and you might not think the benefit of my interaction is that I'm helping this patient. You may see this as, this is another case I get to do, and it's going to be 2 hours, and it's going to be efficient. And I think the way we've lost our way in that sense is what's driving this wellness problem. And I think one of the bigger issues is that I was kind of talking about the tracks before, but what do you do when someone's not happy in that scenario, right? So if somebody is a med student and they start struggling with that problem, what does that med school do to address that? Do they just send you to therapy so you can, talk to somebody about it and hope that you'll be back on that rotation in a couple days? What does your residency program do if you're just unhappy with how you're practicing and what your requirements are? Are they trying to figure out how you can pay your loans back in a different way? Maybe this clinical job isn't for you. Let's try to get you into a position where all this isn't wasted. And your first job isn't attending. Like, is there any more ownership? Is there any community that will be the backdrop for you if things don't work out? Like if you stay in academics and you stay where you're trained, you always have a little bit more of a safety net. And I think seeing his struggles is why I kind of stayed with people that, like for me, a job selection has always been about who am I going to work with? Like the caseload and all that type of stuff is one thing, but who am I going to work with is important to me because of how much I'm emotionally investing into my day-to-day. He never had that. He never had that support. He probably had the opposite, Especially, I think, in private practice type jobs can be pretty challenging, You're on your own. There's no safety net. And, there is no help, right? Like, he was struggling with having to pay back his loans. You want to take a few months off to kind of figure things out. And there's nothing there to help you.
No, I mean, it's true. I mean, I'm the same way, I want to work with people that not are just good IRs or medical doctors, but who are good people and that you can find some support in them. I mean, a lot of times, one of the things that people can do when they're starting is take time off. But even that can be challenging. I mean, from the just, all of a sudden taking time off and thinking what people think and whether the culture in the practice allows for that, and it can, aside from not being able to make financial ends meet, it's just a tough thing.
It's like a scarlet letter. It's like, when you apply for jobs, it's like, if you had more than a 6-month break, please explain, right? Or, if a kid's applying to med school or residency and they've taken, 2 years off, it's like, okay, but why'd you take 3 years off? Well, maybe I was a production assistant at some show in LA that was cool. I always wanted to do it, and medicine was always going to be there. It's like, well, are you that dedicated to medicine? Well, it's like, I'm applying for residency. What do you think? Like, of course I'm dedicated. Yeah. I'm $300,000 in debt. Like, I need this,
Yeah, I spent this many years studying. Yeah.
Of course. Like, who are you to judge my, just because I wanted to live life a little bit or do something like, and I went straight through. I was in an 8-year program, and I never felt that, I never felt like, oh, I should have, taken this time off and all that. But if somebody does, it's like, that's awesome. That's awesome that you made time for yourself. And my brother never had that option. Like just, I think a lot of, first generation kids, families may not be. Yeah, it's not like our family had a lot of resources to, if things didn't work out, we didn't have like a cousin network or anything like that. There wasn't like someone ready to foot the bill for stuff. Like we all had to survive on our own, and emotionally we were there for each other, and we would always help each other out financially too. But he felt like the loan company was calling. They would call and like be like, hey, you got to pay this month. And he's like, well, I just want to take some time off. Like, how do I navigate that? And so he would have to work and then take a couple months off. And then it's just like the meter's starting, because your accounts are going lower and lower and lower. And, it's not like his med school was like, hey, we knew that you had some, that you saw a psychiatrist in med school or that you saw a therapist back then. Like, let's talk about how we can navigate this and let's give you a plan. And, you could still achieve your dream of being a doctor, but the med school is complicit too. They're just like, here, where's my check? Where's my loan money? Like, there's no like, hey, just take it easy. We're going to, we've made enough money. We have an endowment. Like in these scenarios where you're burnt out, and you've tried everything for your mental health treatment, like what you can practice, like you need to take some time off. There's no advocacy from his residency or his med school or a job, and that's where I kind of get frustrated because there should be that.
I know. I mean, I'm sure we have, plenty of people from academics and then even from private practice, obviously listening right now. And if you think about it, what do you have in your practice to help someone, facilitate a conversation and necessary needs to prevent further mental damage if someone is struggling?
Yeah, I think I do say this with some trepidation because there is a backdrop of retaliation in medicine, and I do tread lightly in these scenarios. Right now I feel very lucky because my local IR group is very in tune with this space, and there's an advocate within our group that speaks for the department that is like, let's talk about what's bothering you frequently, and he has standing meetings, and I think he's the right person for that job because if you ever met him, you'd be like, I want to talk to you, man. I just want to tell you what's going on. And he's there, and he's
that's awesome.
And he's just like, yeah, let me know, right? And that takes a special person, and I think the group acknowledging that is really unique and distinct. And when I joined after my brother passed away, and when I first met with them, I was like, I'm coming back to New York because I feel really shitty being away from my parents. I want to start over and reconnect and start healing, and I can't do that being away from my family. I wasn't like, and then they acknowledged it. They're like, whatever you need, like this, yeah, like of course, that's why we're here. Like it wasn't like some other. It was just refreshing that I could be that open about it, and I was intentionally open about it because in my past I was never open about what I wanted. I think we're all kind of ingrained to not say to a possible employer what you want or how you feel. You're always like, well, I just want to be a big part of the group. Any case really interests me. I'll do whatever. We only take call this. That was how I was, like, oh, what do you want to do? Oh, I really like onc, but I'll do, lines and I'll do recans if that's what the group needs. And then that's what it's like, right? But for me, I was like, I just want to be able to be there for my family, and the rest of the stuff will settle professionally. And again, I'm treading lightly here. That wasn't my first conversation with a group outside of California. And I had talked to other groups too. And in the aftermath of my brother, I sent out a tweet, expressing a lot of my, that I was angry with the system, and the financial motivations that put wedges between patients and their doctors, and a lot of these things that I talked about. And one of the groups was basically like, nope, you're not the right person for us. Yeah.
Now, based because of your on your opinions on your tweet, it was from that?
Well, listen, no one's ever going to say that out loud, right? They're never going to be like that. But
yeah.
But the timing, and they reached out to somebody that they knew, and they're like, is he okay mentally? And they're like, yeah, he's fine. He's just lost his brother, and he's just talking about it. Like,
yeah.
And they're like, oh yeah, not for us. But again, that's part of the culture, right?
Good that's the culture. Exactly.
That's retaliation. Whether it's I didn't. At the end of the day, that I was fine. Like, my group in LA was super helpful. Like, during all this, I felt very protected by them. And I think I do need to talk about that a little bit, about what it was like at work.
Yeah, how was it? Let's talk about it. I mean, your brother is going through his. I mean, this whole event, I'm sure, made you go through a lot. How did you deal with it at work?
When I was at USC for a while, I trained there, and the people I'm working with are like family to me. They all came to my wedding. My section chief always knew that I was juggling. I was away from my family, and I was juggling this thing with my brother, because my brother had lived with me, and I would just talk to people about it. And then a couple of guys at work are like brother to me, Stu and Ray, who you know very well, and they knew, and we would always talk about stuff, and they would check in on him too, and he was good and all that, but it was getting a little hard for me to navigate this whole thing without being so far from my family, and that's why I started like considering leaving and all that. It's not because of anything related to the group, but they were very, very supportive of my challenges. I think the way I handled it was not great. I let it eat at me inside, and I was apologist for the system. I was like, to my brother, you're wrong. Look at me and my career. Like, I'm doing well because I put my head down and endure. But then, was I doing well in my career? Like, I don't know. What does that mean? What does career success mean? Like is it just like a line on my CV? I don't know. I mean, would I throw away my CV to be more supportive of my brother? 100%, in hindsight. But at work, everybody was, they acknowledged it. And, the weekend that it happened, I was on call. So, I didn't really have the bandwidth at the time of, kind of figuring what's going on out, right? Like, so.
To process it, yeah.
And this is just like a warning to whoever's listening. I can kind of talk about those 2 days. Like, he was doing a locums thing. He called. He was very upset on Saturday, like very upset. And I was like, dude, like, I don't know what to tell you right now. Like, what has your doctor said to how to behave in these situations? Like, what has a professional told you? And let's enact whatever we need to do. I knew he had expressed suicidal ideation to his doctor at one point, but he never, like, you never think someone's going to do that. Like, you never, and I can't underscore this enough, you never think someone's going to do it, especially your own family. Like, I knew my brother more than I knew anybody, and I knew he would never do that. Do you know what I'm saying? Like, I'm like, dude, like, and I asked him, I was like, do you need to go to an ER right now? Like, I'll call an ambulance. He was in Phoenix. I was like, I'll call an ambulance. He's like, no, I'm going to drink some water and lay down. And I was on call, so like my bandwidth is like, I'm dealing with these calls and I'm dealing with this, and I'm like,
sure, yeah.
Damn. So and I had a case that day, so I went and did the case, and I'm calling him and he's not picking up his phone, and my parents are staying with me at the time, and I'm calling him and he's not answering. I was like, damn, like, and in my mind I knew what happened, like I knew it, and I didn't know how to talk about it with my parents. So I was like, I don't even know where he's staying. I don't know where he's doing this locums assignment. I know it's Scottsdale or Phoenix. So I go, I'm home that night, and I'm just like, I don't want to say anything to my parents, but I'm like, maybe he's just sleeping. Because sometimes when he would sleep, he would have a marathon sleep, 10, 12 hours, like, no problem. 4 a.m, I'm calling him, it's going straight to voicemail. That's when I knew something was very wrong. So I'm like, maybe his phone is just off, and then in the morning he'll give me a call and be like, yeah, Like, because, he's had rough days before, and he'll call me and he'll text me and like, he'll be like, sorry, I love you. Didn't mean to put you through that stress, like whatever. So Sunday morning, I took my parents to the temple, and I'm like calling police departments in Scottsdale and Phoenix. And they're like, what hotel is he staying at? I was like, I have no idea. Like, I have no way of answering these questions. There's no emergency contact on his locums thing, I think, apparently. He had been in Arizona before for a year, and he had like a couple friends there that I had like reached out to friends of friends being like, do you know any, like, has he reached out to you? Like, do you know where he's staying? And somebody called me back and texted me like, oh, I think I was supposed to grab dinner with him last night. He's staying here. So I called that hotel, and they're like, oh, we can't do anything, blah, blah, blah. You have to call the cops. I called the cops. And at this point I know, right? Like, I'm at the temple, but I'm like, I can't, like, I'm outside. My parents are inside. And then we start driving home, and I get the call, right? It was like a detective, and my parents are in the car, and you know how your phone automatically connects to Bluetooth. Luckily, I was smart enough to take it off Bluetooth and just answer it like a normal phone call. And then how I got from Malibu to Santa Monica, I still don't. Yeah. That's like the shock.
Your mental was
the shock is
yeah. You're fogged.
When the detective was talking to me, I was on that intersection, that incline from PCH to Santa Monica.
Yeah,
that's when I got the call, and then I get home, and I think my parents knew something was wrong, but they weren't talking about it because outside of medicine, brown people don't talk about their feelings. And so I ended up talking to them right then and there, and I was still on call at this point. I called Stu, and I was like, I wasn't crying at this point. I was in complete logistic shock mode. I was like, Stu, I need you to take call. And he's like, done. No questions asked, right? Stu. It wasn't like, oh, what's going on? How long? He's like, done. That's it. That was the phone call. Yeah. And then, an hour later, he's in my driveway hugging my mom. And like, honestly, dude, like that moment where like, IR is a small community, but like there's some good people out there. He's one of them. Like,
yeah.
Just like letting my mom interact with him was like,
that's the biggest support.
Yeah. And then I called my, he called my section chief to be like, Jay's not coming to work for a bit. And I never like told Stu what happened. He just knew. And then my section chief called me, and he's like, heard something's up. Let us know when you're back. And then I kind of told him what happened because he knew what was going on.
That's Bob.
That was my Katz. He was section chief.
Oh, Katz. Sorry, yeah.
Yeah. And then Katz called Bob. And Bob texted me or called me. He's like, yeah, like, don't worry about work. See you when I see you, that type of thing. But Bob had no idea what happened, which I think is one of the coolest things about Bob, is that he never knew. And then he would just reach out. And then when I went back to work, he's like, we were just chatting. He never asked me anything. He was never like, what happened? Like, that was his prerogative to know, right? He's my boss. Like, why is this guy taking a month off of work? Like, he never, and it just shows the classiness of him, like that type of stuff is, but yeah, everybody was very supportive.
These are support networks. I mean, these are things that are not ever, outlined in a contract or outlined in a job. Like, these are support networks that you have, even if it's just like, okay, do what you need. You have everything waiting for you when you're back. Just having that, knowing that that's there, and actually believing it too. I mean, it's does whole world of wonder, probably to your own mental health right there.
Yeah, I think just knowing that, like, I flew to New York a few days after to, like, do all the funeral and all that type of stuff, and knowing that, like, there was paperwork that needed to be filled out for, like, using my vacation days or bereavement time and all that, like, and I never saw that paperwork. Like, my Katz took care of all that stuff, right? Like, he was just behind the scenes being like, and that's the type of support that I had there. So leaving that group was really hard.
Sure. Oh yeah.
I know people like want to. Right now, USC is in a lot of change, and the people in IR, diamonds in the rough when it comes to being people. And I wish that narrative was publicly known. I always felt like it was my little secret how awesome those people were.
Well, now people know.
Yeah, and now people know.
Yeah.
Yeah. And I think, when I was coming here, that was part of the thing, right?
Sure.
It was like,
that was probably the top of your priority of any job, to be like, I don't care what kind of cases you're doing. I don't care where I am.
Right.
I need to be next to family. That's it. But I need that support,
Yeah.
That needs to be the MO, not, hey, bust out how many do this complex case and do more of them and be a, researcher and such. I don't know, your typical.
Yeah. I mean, part of the conversation was like, I told them that, and I talked to all the people in the group, and, and it's really proven to be true that they're just there for you. And I never trained with them really. I never really work with them, but they're willing to be there for me, which I think is very special. But I feel lucky more than this is how people behave. You know what I'm saying? Like, and my frustration is that my brother never had that environment. And I think there's a lot of people out there
who don't.
I would say most people don't have that environment.
And it can even be mixed. It can be an environment where some people are like that in your group, but some people aren't. And then that culture, obviously the most negative part of the culture is the most important in any situation. So if you have a few bad apples, it can really then it's crazy. Jay, I mean, there's a lot that everyone can kind of learn from any of these conversations. I mean, just from ours. I mean, it's just to be there as a support, to see, and if you see someone struggling, like, help them. Don't try to avoid the conversation. Try to mask it with something else. People who are struggling out there to speak up.
Yeah, I think the biggest thing for me is, like, if you do seek out a position of leadership, whether it's a medical student leadership position, a residency, in your private group, in your faculty role section or whatever, you need to care about this as like a number one priority of, like, don't just think about the prestige of getting a leadership position. Think about how you can change someone's life for the better if they are struggling. And oftentimes, just the ego drives people that seek leadership positions to use other people as stepping stones. So their pain is not your pain. Their pain is your glory. Because if those people are working hard and putting up with whatever BS comes their way and are doing, the lines within, the same day they're consulted, you may look good as a leader to the hospital, but are you doing what's right to your colleagues? And I think, if you do seek these positions out, you should care and have a plan for what you're going to do to support somebody through a tough time. And that's where I think the disconnect is, that the people that are in positions of power, sometimes they just want you to go along with the system. You know what I'm saying? Like,
totally.
That's just, and if there's a mental health crisis, it's only going to be getting worse. I mean, there's all these data about what social media does to people. Like, the breed of student coming in may be exposed to things that you're not exposed to. And so you have to be prepared to deal with it. And if you aren't prepared to deal with it, or if you're tiptoeing away from this issue, then don't seek out a leadership position.
I mean, wow, Jay. Well, I think we're gonna wrap it there. I mean, this is a powerful episode, powerful conversation.
Sorry if we talked about too hard stuff.
No, I'm glad we did. I foresee this being a very popular episode.
I think if you are struggling, do not feel bad. What we do is hard and it takes a lot out of you. It's normal to struggle, to not feel like you're doing your best, to feel inadequate, to feel a little bit less than. But you need to be able to voice that, and without fear of retaliation. And that takes everybody in our field acknowledging that we have to make a safe space for this. And if you are really struggling to the point like my brother, there are resources and we could share them, phone numbers, to call national hotlines for,
Yeah.
to get support for, and go within your system. And if your system is not working, just reach out. You can reach out to me. I will help you navigate whatever you need to. There's not a day that goes by that I don't wish I did more for my brother. And the only way that I can bring a little bit more peace to my life is to be able to help somebody else. So please, like, you are never going to be alone in this battle as long as I'm around. Just please reach out to somebody that cares, and we'll help you navigate something.
Yeah, man. Well, thanks, Jay. Really appreciate you being on. And literally, I'll reiterate that if any of you are struggling or know someone who's struggling, please use these resources. We'll attach it to our episode, and they're very easy to find if you Google. But use anyone. If you want to contact Jay, you can reach out to him. You can reach out to me, any one of us. We're here, and let's keep on bringing the awareness, and I'm sure this will help many people, not just one. Thanks, Jay.
Yeah, appreciate it. Thanks.
For those experiencing a suicidal crisis, call the National Suicide Prevention Lifeline at 988.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend. If you have any questions or comments, direct message us at @_BackTable on Instagram, Twitter, or LinkedIn. BackTable is produced and hosted by myself, Aaron Fritz, and co-hosts
Chris Beck,
Sabine Dong,
Michael Barraza,
and Ali Behetti.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter,
Aaron Bowles,
Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Ann Dang,
Manisha Naganathanahali,
and Manbir Singh Sandhu.
Administrative support provided by Jamila Kennebrew.
Intro and extra music is Ripperoo by Skeptic Moon. Find us on Spotify or at local live music venues in New Orleans, Louisiana.
Thanks again for listening.